Thank you so much. That was a good answer, huh? I told you, she's good. I think when we talk about that, sometimes in those family meetings, it always the word respite for the person who has been the major caregiver that maybe is spending the most time taking care of the care recipient. And so, Joni, you talked about respite, and maybe just for clarification, because there are several people here, many people here that are new to all of this. So what is respite, and where can they find respite? How do they find it? What is it, and how do they find it?
Respite is defined as a short period of rest or relief from something that is difficult or hard work. But it's also very important that the caregiver defines what respite is to them. Like I mentioned earlier, just some quiet time alone to read a magazine, or 5 days with your loved one, and it's safe in a facility so you can go and visit family or go to a wedding or anything like that. So respite is most importantly what the caregiver needs. As far as where to find it, first we're looking at your informal supports, whether it's family members, friends, neighbors. I have several of my caregiver clients who have neighbors that stop in and help them when they need to go to the grocery store, and we'll just sit and visit. Also, your churches, different organizations, there are people out there that you can trust and that can stay for short periods of time with your loved one. The formal supports, you could start with my agency again, the Area Agency on Aging. We do have a respite program. We're able to provide anywhere. At this time, it does vary with funding, but at this time it's anywhere from 8 to 10 or 12 hours a month. Someone come into your home and clean it, help care for your loved one, play chess, put a puzzle together, anything that would work for you. Veterans Administration, if you are a vet, they also have a program. Best to look at those in January and I believe that's when their year begins. Sometimes they do run out of funds towards the end of the year, but always call and ask. Hospice agencies, like we talked about earlier, several of my clients didn't think that they would even want hospice in there because it kind of meant something different to them. Once they understand that it does not mean that within a month your loved one is going to pass away, but that they're there to assist and make sure everything is as good as it can be, then they have that 5-day hospice stay available. Also, hospice agencies usually sometimes have volunteers available for respite. I know that they try to have them available. They're not always available, but it doesn't hurt to ask them what they could do for respite for you in your home. Home health agencies, paying privately for it, those are always available. And again, through our agency, we have access to information on all of the different ones in the area. Check your long-term care policy in case it has anything in it that can help pay for some respite. Mm-hmm. Not all of them do, but check and see if it does. Friends in Action, call them about respite. They have wonderful volunteers and a wonderful new program with the Legacy Corps. I guess I did find an internet site, but I'm not going to give it to you because it doesn't work. It looks like
sharing.
It would be wonderful. It's eldercare.gov, but if you can get it to work, I think it might be really nice.
You'll have an agency of one. Yes, Angela.
I just want to point out that respite for children's care programs is very different. And
Sure.
so if you are interested in learning more about that, you could check with our organization. Medicaid works very differently for how that's paid for children. In fact, it's brand newly now will be a service that children can receive through Medicaid beginning, well, now for some children, but by July 1. So.
And remind people what agency that is.
Idaho Parents Unlimited. So.
There you go. Great.
And
Thank you.
may I add one other comment? One of the
may.
things that we frequently hear from family caregivers is, I don't know that I want to have someone come into my home because they won't do it the way I do it. They can't do it as well as I do it.
True.
And it's true. They can't do it the way you do it. They might do it differently, but that's okay, because again, respite is about you and taking care of you, and that's why it's so important that you seek respite.
Thank you, thank you, thank you. Dr. Steve, I have a question for you. This one was hit home with me when I read this question, and I said to Stephanie, I said, this one is really, to me, was just crazy nuts in my life with my father, because when my father would go to the doctor, we had to sit out in the waiting room. The command from my father, you will sit here, I will go in by myself. So here's the question. How can we get my mother or my father's health care provider to communicate with us and include us in mom's care planning? We provide so much care for mom, but she doesn't tell the doctor that. Does that sound familiar?
Well, and this can be.
It's just a naughty microphone.
There we go. This can be a little bit difficult because of privacy concerns.
Right,
And
right.
so we do have to respect the privacy of somebody who is mentally capable to make that decision. I will say that if you've gotten to know the care team, so the physician, their nurse, their staff, there are ways to communicate problems that are probably not being communicated by the patient. And so I think it's very important to, again, reach out to the staff or the physician if you have that opportunity, but to get a message. This is, I guess this is different than I do have people that come in with their family, and we now are having more electronic communication, more avenues for electronic communication where the caregivers can actually communicate outside of that visit interface. But one of the things we run up against is then if there's sort of a question about behavior or some type of habit, such as alcohol or something like that, because of privacy concerns, it is very difficult for me to bring that up just out of the blue and say, hey, are you drinking too much alcohol? It can make me more attuned to it. And so I can receive as much information as you want to give to me over the phone or by letter, email if you're fortunate that way. But I can't then, I can bring it up to the patient the next time I see them, but many times there's information that the son or daughter wants to give me, or the spouse, and don't tell them I said this to you. Well, that makes it pretty difficult.
Right.
But then at least I'm knowledgeable about this potential issue, and I can try to weave that into the interview the next time I'm seeing the patient. But that is a very difficult problem. I think try to work with the care receiver as much as possible to let them know that you're concerned about their care and that you would like to participate in the doctor visit. And I would try to do that.
All right, thank you. That is a challenge. It is a challenge. I finally just got strong enough and just followed my father in, and he just says, I remember him looking, you go sit down. I go, no, I'm not.
Yeah.
I turned into 2 years old, and and I said, and I can make a real big scene here, or I can just follow you. It's up to you, but I'm going in with you. And he was just all puffy, but it was wonderful. But then exactly what happened is we got there, and I said, well, Dad, tell him about this, and ask him about that. And it was like my dad didn't want the doctor to know any of that stuff. And I'm going, wait, this guy's here to help you. If you don't tell him. So it was, but sometimes you just, I don't know, it's called defiance. Sometimes it works, in fun. I mean, it was a fun, goofy, I wasn't mean, I was just joking, and, and I was not going to sit down in that waiting room one more time because it was just getting ridiculous. But, so you have to push a little, I guess.
Yeah, and I would be fine with that situation as long
thank you.
as the patient
Right.
was agreeable.
Exactly, because it's about respect for the patient.
If it didn't work, you would just say, okay, I'll go sit outside. But
Yes, yes.
hopefully they would let you in. Yeah.
Right. We would have had fun. Okay. Now, Donna, This is an interesting ethics question that I thought, wow, this can really happen so easily to someone. My spouse has dementia. He has a handwritten will, but I would like to have it redone by an attorney. My concern is that his dementia has progressed, and how can I make sure that this is done ethically?
Okay, well, thank you. Is this working?
I think you just have to bring it a lot closer, like
Okay.
almost to swallow it. There you go.
Well, this comes back to Dr. Matamat's comment right now, and that what he was saying is that his relationship, his doctor-patient relationship, is just that. It's with the patient. Just as with an attorney, the attorney-client relationship is with the client, not the client's spouse, not the client's adult daughter, adult son, grandchild. And so that is, I think, the biggest part of this question. And ethically, I cannot do a will based on what an adult daughter wants her dad to do. My ethical responsibility is to draft a will that reflects dad's wishes. A handwritten will is valid in Idaho. It's called a holographic will. And there are, generally speaking, very generally speaking, 2 requirements for a handwritten will to be valid. Number 1, the material provisions have to be in the handwriting of the person who drafted the testator. It's called the testator, the person making the will. And secondly, it has to be signed by the person making the will. I can tell you that it's not entirely uncommon to have a handwritten will be the source of litigation, especially when there's undue influence that may be exerted over a person making a handwritten will, and whether or not they had capacity at the time that they made the will, testamentary capacity. If there's any question, certainly a spouse can make an appointment to have husband or wife go in to see an attorney to talk about the handwritten will if it is, in fact, if there are problematic areas in the way that it's drafted. But again, unless the person who drafted the will is willing to go in to see the attorney, it's not ethical for an attorney to review that. I'll say that. But the other part of that question is how does an attorney determine that somebody has capacity to make a will? Testamentary capacity is the lowest level legal level of determining capacity for any other type of document. You basically have to understand what it is you have and who it is you want it to go to. So I have my own set of questions in interview, so to speak, that I do to determine whether somebody has capacity or not when they have a diagnosis of dementia or Alzheimer's disease. It doesn't preclude you from making a will just because you have a diagnosis of Alzheimer's disease. There is a certain level of capacity that you do have to maintain in order to have a will done.
All right, thank you. Tough question.